This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome aboard, folks. Dr. Charles Parker here, and we're so pleased today to have a very interesting person. You know, our theme here has been very frequently dealing with vets and trauma and the trauma of life. And today we have a very interesting guest from the UK. And you know what, Elizabeth? I made the mistake of not really asking about your last name. Is it Adalian? Is that how I pronounce it?
Adalian.
Adalian, okay. And so, Elizabeth, thank you so much for joining us. I'll introduce you formally in just a moment.
It's a privilege.
So, folks, first of all, before we get started, I just want to mention quickly our two valued sponsors. And you listeners already know how much we love the reality of data here at Core Brain Journal. And today we welcome our clinical friend and new sponsor partner, Direct Health Access Laboratory. With over 3 million studies, they're deep leaders of experience with a big picture of measuring, for example, methylation, cryptopyrrole, and copper challenges. We've talked a lot about that here at Core Brain Journal and the relevance to brain function. They provide global service with a molecular focus. Stay tuned, more about them later. And then you also know how much we appreciate detailed improvements with mind care, different on the edge, really traditional types of care that are improved and where they really do the job better than in the past. And today we're also pleased to welcome another sponsor and partner with a deep interest in fresh options to address the frequently overlooked complexity of adolescent treatment failure, both nationally and internationally, and is built TRICARE friendly. They're very involved with the entire international community. The Barry Robinson Center right here in beautiful downtown Norfolk provides a holistic environment that's different. It sets children, teens, and families on the path to healing. From personal experience, I know their work with families we've shared over there, a truly different residential experience. More about them in a moment. So thanks, guys, for listening, and thanks for attending here. Now, so this is going to be, as I said, on the theme of trauma and recovery from trauma. And Elizabeth is a person who brings an additional wrinkle to this entire conversation in that she is a trained homeopathic physician from UK. And I think a lot of us here in the States don't really understand what's going on with homeopathy. Just as a side note, you may be interested, Elizabeth, I went to my child residency, was in a hospital, which it was in Philadelphia, and long ago had been a homeopathic hospital. It was the Hahnemann Hospital down in downtown Philadelphia. Hahnemann was apparently very involved with homeopathy. Of course, by the time I got there, there was no such thing going on. And now it's Drexel University. So moving along there, being an osteopath, we have some appreciation of what's going on with homeopathy. So what's going on is that Elizabeth is the author of a recently released book, Touching Base with Trauma, Reaching Across the Generations, a three-dimensional homeopathic perspective based on her work as a homeopath in former war zones. She's been a practicing homeopathic physician over 30 years, and she's worked in 10 different countries, as well as her main practice there in London. At the same time, she's taught in many of these countries, as well as in the UK. So, Elizabeth, we're really looking forward to hearing about you because you bring a diversity of experience and a different perspective, which we're so interested in. So tell us a little bit about yourself and how you happen to take, first, the homeopathic path, and what is homeopathy for those who don't know?
Well, homeopathy comes from the Greek word homeopathy, which means similar suffering. So when a remedy, which we use for a sick person, is given to a well person, it creates the very symptoms we're trying to treat in the sick person. And it was discovered by Hahnemann, who you mentioned in terms of the hospital, because he was so disillusioned at the time with orthodox medicine. And he started experimenting with himself and discovered this whole theory of homeopathy through his use of the remedy China, which is used for malaria. So as a healthy person, when he took it, he actually developed symptoms of malaria. And that's how homeopathy was discovered.
So the issue there, my understanding was always that in terms of similar, that you treat a person with a kind of small doses of whatever the issue is.
Yes, minimum dose.
What did you say, ma'am?
Minimum dose.
Minimum small doses. And then they develop a certain measure of healing, biological, physical healing as a result of the introduction of those small doses, and then can then heal the larger picture. Is that correct?
Yes, we believe in the vital force, which means that the body is self-healing. So the remedy triggers the vital force to re-find its equilibrium.
Well, see, that makes it very interesting, because in trauma, you wouldn't think necessarily that there would be an application for that kind of insight or practice. So how did you personally get into this kind of awareness and begin your practice?
Well, I discovered through working in former war zones that the way people reacted to atrocities, however severe they were, depended not so much on those atrocities, but what that person brought to that experience from their formative years and the resilience that they'd acquired through the influence of their family background and the messages they received from their community as a young child.
Mm-hmm. So then they had a certain perspective based on childhood experiences that would then either strengthen their resilience or create a situation in which they were more likely to be significantly compromised by whatever the experience was.
Yes, I would say so. And the most interesting aspect of that was when I returned to London, I received a patient who was actually from Croatia, who hadn't been back since she was a child and had only by accident seen images of the war there on television, and it had thrust her back into her childhood experience of being carried through the rubble in her mother's arms as a baby. And this had never been discussed with her. She'd had no active knowledge of this experience. But somehow the cellular memory was re-evoked by this image. And she ended up in a very primal state. And only homeopathy could bring her out of that suffering.
Well, that sounds terribly interesting. So please tell us a little bit about how you did that, how that work occurred with that patient.
Well, she arrived in a highly emotional state on heavy medication. And the most interesting thing about her was that she wanted a diagnosis. And I said to her, well, actually, as a homeopath, we don't set out to give a diagnosis. But there is a possibility you're suffering from post-traumatic stress disorder. And you know that in itself was part of the cure. She was so relieved, and she immediately intuited that that was what had happened to her. And she also received remedies which actually took her back in time to resolve that very, very embedded trauma. But during that process, what was so interesting is that she reverted to being a small child. So even though she was in her mid-50s, she had to sleep in bed with her 84-year-old mother. And what was so interesting was her mother still babied her and understood the process. And by the time she received all the treatment and her mother actually died, I was rather worried about her reaction, but it was quite healthy and quite fine. And I was very privileged and pleased to see that homeopathy had carried her through this whole journey of treatment.
Well, you said a word that I'm sure alerted some of our audience, and that word was remedy. And it may be just the perspective of your language, but was there a specific physical remedy, or was there a specific physical pattern that you set up that was an if you will, an operational grid that was, kind of objectively determined in terms of what you wanted to accomplish?
Yes, there is a particular remedy based on opium, which resonates with the kind of embedded trauma that she was suffering from. And what's very interesting about that remedy is that it actually brings out the primal response. So after receiving that remedy, she was very aware that this message had never been given to her. And I realized too that because she was pre-verbal at the time of the initial struggle and suffering, that there was no articulation for the suffering. So it had been suppressed for all those years and then was so easily re-evoked by this tiny image on a passing screen. And the remedy that helped her after that, when she reverted to that primal state, was Stramonium, which is a very primal remedy for abandonment. So she felt very abandoned, not only by the situation, but by the fact that the knowledge had been denied her all those years. She always knew that something was wrong, but could never define it.
So then what happens, just to elaborate more clearly and take this person as a jumping off point so we can all be more educated about this interesting process. First of all, if it works, we need to know about it. I mean, if this helps someone, then we need to understand how it happens. So is it a fact then, from what you're saying, that homeopathically trained individuals, I don't know if even if it's correctly to say you're a homeopathic physician, is that what you call yourself?
No, because in England, most homeopaths are not physicians, we're homeopaths.
Oh, okay.
Some doctors do study homeopathy, but they're still medically based, whereas we come from a pure homeopathic angle. Although obviously we do have some medical knowledge, so we can recognize and treat pathology at the same time.
Okay, thank you. I'm sorry about that misunderstanding. So then the next question is, so you do have, and the homeopathic group does have, a number of physical, really, for want of a better word, drug preparations that are prepared that create certain reactions in the brain and with the body. They're like medications in a sense, but they're not medications.
They are, but I would say that they're very individualized. So that particular patient needed that set of remedies. But another patient who may present with parallel symptoms may receive completely different medication or remedies because their story has got a different base. So we're really looking for the nuance within the presenting picture rather than just giving formulas. The true homeopath does not work with formulas.
Elizabeth, I don't know how much you've heard our comments on these recordings at our podcast here at Core Brain Journal, but that's exactly the way we think. I mean,
I'm glad to hear that.
I mean, we just cannot do cookie cutter work. I mean, individuals need to be treated very specifically and very highly customized. And nuance is one of our favorite words. I mean, people get missed all the time with cookie cutter assessments and labels that are inadequate to discuss that human beings' interaction with their past life and the whole thing. It's just why there's so many complexities to do something without thinking about it just doesn't make any sense anymore.
Well, one of the reasons I wrote the book was to show the nuances and to define the remedies with that very fine line of difference so people can establish which path to follow and not to fall into that formulaic approach.
Very interesting. So, to just elaborate a little further, like you were mentioning something, strontium. Was it strontium you mentioned?
Stramonium.
Stramonium. Well, what is stramonium? You had mentioned an opiate. Is stramonium an opiate?
No, actually, it's a weed. It's a Jimson weed.
Oh, Jimson weed, yes.
Which actually grows in graveyards.
Oh, yeah.
That in itself portrays the isolation and the despair within the presenting patient. So we often look at the doctrine of signatures of the medicine, and that portrays a lot of what is needed in the patient.
So then what actually happened in terms of her evolution as a person? So Is it just the medication preparation itself? Are there some other, it sounds like there's some working through some actual activities in addition to the medication. Is that correct?
I would say absolutely. And to work at such a deep level with such a patient, you need to have very skilled ability to help them through that process. And there will be setbacks, and they will need your support during those setbacks. And there could be a time when you may need to repeat the remedy because something has re-triggered the memory. But it's a combination of the treatment and your ability to follow through with the patient and to guide them to the full path of healing.
So then tell us a little more. That gives us a foundation for further discussion. So please share with us a bit more about some of the other experiences you had in different countries that were downstream from trauma and where individuals were arrested in their recovery, where they had treatment failure, any of that kind of sort of thing. And did the countries differ? Did the experience in the different countries differ for you?
Are you saying that the way people were treated in their country would be different according to the country?
I'm wondering, yes.
Yes. That's very interesting, isn't it? Because if you look at a country like Croatia and Bosnia, where there was a history of communism, so there was a lot of collective thinking at the time. After the breakdown of communism, I would say that there was a quest for individuality, for people to experience life according to their own model and not to fall into that particular pattern. So there was a fight for individuality, but there was also a struggle to find the individuality within that patient. So there was a duality there that they were struggling with. And that was part of my mission, to understand that. And when I was accorded the role, I was actually the chief homeopath working out in Croatia. They actually told me of all the countries, that was the most difficult one to work in, because people had this duality and they were very, very entrenched in their hatred of the enemy, and there could not be any reconciliation. And part of their suffering was that entrenched hatred. And to help people to break down that hatred was part of the mission through the remedies plus the message of the healing that we were to give them.
So I would assume with the hatred, much of the internal conflict was externalized. So
Absolutely.
that they had to switch it around to become more internally focused to actually and resolve some of that external focus in order to actually heal.
And they also were quite aggressive to me because they felt I'd come from a very complacent place and I hadn't undergone the suffering and the dogma that they'd imbibed for so many years, not only through their own lifetimes, but through their parents and grandparents. So they felt I was in a very privileged position and maybe not exactly the right person to try to influence them away from that mindset.
Yeah, they probably assumed that you were too weak and they were hard and they didn't want to go over to a weakness to get better.
Well, something like that.
I mean, I'm exaggerating, but we see that happen all the time here in psychiatry in the States. I mean, psychiatry is considered by many to be pretty much a weak, weak sister for without being gender specific. But I mean, it's like they're all softies, just thinking about things and not doing anything in reality.
The interesting thing is that I also worked in some very wealthy countries, including Qatar, one of the oil states. And I must say there that people were very cloned and there was very little individuality.
Well, tell us a little more about that, please. What was your experience there?
That everything was kept very much under wraps. And it was interesting when the wraps came off that there was a lot of expression and a lot of suppression, because the culture, they found it very hard to break away from the norm and the expectation.
Interesting. So as a society, they were used to not sharing their feelings.
Not really, because the expectation, particularly for women, was that you fit into a certain box and you can't get out of that box.
Mm-hmm.
So by treating them with homeopathy and encouraging them with their individuality and their individual expression, that was rather taboo for the culture.
So how did you do that? What was the actual structure of the work? Did you have a facility that you were working in, or did you have an office and then they went home to their original culture? How did all that work out?
Well, basically, I'd been working in Egypt, and I was actually recorded on satellite television while I was there. And that program went out to Qatar. And as a result of that, they invited me to go there for a week's commission.
Mm-hmm.
And so they lined up many patients for me. And because of the very enmeshed community there, they were mostly related.
Mm.
So they had a lot of privilege, but very little vision. So my question to myself was, do I collude with their privilege and just palliate their symptoms, or do I actually go the full hog and treat them so that they can become liberated through the healing to reach full potential?
Mm-hmm.
And in the end, I decided that I would be true to myself and try to convey the message of the healing and also support them within their boundaries of family morals and values. So the cultural component for me is incredibly important.
Mm-hmm. So you had a political problem as well as an individual problem.
Yes. I had a fascinating case, which I must tell you about, which was only recently in London, where an Indian boy was brought to me with marked behavioral problems, a boy of 10. And he arrived with his younger sister of 8 and his parents, with very healthy dynamic, I must say, of the family. Quite a lot of emails had been exchanged between us before I met the boy, so I knew that it was quite a wholesome setup, although the boy was very troubled. So when he walked in my consulting room, I said to him, what do you see as your problem? And he said, I just argue with mum all the time. Only mum. Not dad, not my sister, nobody else, only mum. So I kind of put that at the back of my mind. And as we went through the case, nothing much was revealed. And then at the end of the interview, I turned around to the parents and I said, well, was there any trauma before the pregnancy? And they said yes. The mother of the grandmother, the potential grandmother, had died in horrific circumstances. They didn't spell it out to me, but it was obviously very traumatic. And then the father said, but we don't do emotion. We just don't go there. And that was the key of the case to me. And I shared this with the father later because he was very, very interested in the treatment. He'd taken this boy to many people for different types of healing, and he was very desperate. And I thought to myself, this man is on my side. He respects my approach. So I told him, and I said that I'd researched this book, this could be the problem. And at first he was taken aback, but then when they discussed it, they both realized that maybe that was the key of the case, and they were very happy to come on board and maybe even speak about it to the boy in a moderate way. But I feel that secrets in families can be very toxic. And maybe that was why the boy was so disappointed in the mother, because the mother had not been able to give her full attention to the pregnancy, being so preoccupied with the trauma of the loss of her mother in those circumstances. And I don't think I would have elicited that before I'd written the book and done all the research.
Did you in fact elicit that before you wrote? I didn't quite hear that. I was interrupted you.
No, that was after I'd written the book.
Oh, shoot. Too bad. Well, let me ask the question. So then the issue was interesting from the point of view from now, I'm going to put my psychiatric hat on here for a moment.
Please do.
Then the issue would be, how much of the trauma of the mother and mother's relationship with her own mother carried over after the birth of the child into even that first 1 or 2 years of life.
Well, I agree with you, and I see those years as so impressionable, and I think that it really is the elephant in the room that we overlook that in our healing. And this is my message, to get out loud and clear that this is what actually modulates our responses in life.
Mm-hmm. Well, those early years are absolutely essential, and so frequently individuals don't appreciate the complexity of children. They don't have an awareness of what the child experiences in terms of what's really going on for the child.
No, and I think we protect our children a lot. I did quite a lot of research around the Holocaust in preparation for my book, and I can see that there is a huge survivor guilt that reigns among the Holocaust survivors, which does get passed down through the generations. And I've been to a book reading recently in London, and it was interesting to see the third generation say how much they related to that, and how what wasn't discussed in the family was actually more painful than that which was discussed. So a lot of the details were kept from the children, but somehow they felt it and they suffered it.
So the survivor's guilt would keep the individuals quiet.
Quiet and non-demanding and non-expressive, maybe suppressive.
Mm-hmm, mm-hmm. So they would train the individual to deny what's the internal conflicts and keep.
Well, I think it's unconscious, and I think it's the unconscious which actually determines what happens to us in life. The unconscious dynamic in the family background, what doesn't get expressed but is acted out in the offspring.
That's interesting. You do sound like a psychoanalyst, Elizabeth.
Well, interestingly enough, my brother is a psychoanalyst and my mother was a psychotherapist, and I've always surrounded myself with psychotherapists. Yeah. But I enjoy working like this.
Well, now back to that boy and back to the original homeopathic part of the conversation. Did you use specific remedies with him to help facilitate that verbalization and overcoming the trauma and actually coming to grips with himself?
Absolutely. And one of the things I noticed mostly about him was that he was inciting all of us in his behavior. And he had a very typical behavior of a certain remedy. And I was very much suspecting that that was the remedy he needed. But I needed confirmation to understand what was the trigger to his state. And not having been able to elicit it through the general case taking, once I inquired about the trauma and discovered this death within the immediate family, then it just confirmed that remedy for me. Mm-hmm. And I felt very positive that that remedy will dissipate a lot of his behavior, because at the moment he's challenging at school and he may lose his place at school. So they're pretty desperate to find a solution for him.
So then what does the remedy do to the person that facilitates their coming to grips with themselves? I mean, I'm not asking you a neurophysiologic question because it probably isn't there, but I'm just wondering what you would expect if you're not a homeopathic physician or a homeopathic practitioner. What would a parent expect to see with in this particular case, a specific remedy that you would know that the child was moving into this next level of awareness?
So if I understand the question correctly, what you're saying is if you're an observer but not a homeopath, how would you know if that remedy was working?
Exactly. Yes, ma'am.
Well, you would observe that the tension would be taken out of the child, that there wouldn't be articulation of that difficulty with the mother, and generally he would be more cooperative at school, mm-hmm. and happier in himself generally.
Mm. Very, very interesting. Yeah, that's, it's what we see if we're doing it right over here, but it's non-pharmacologic approach, which I'm sure would be attractive to so many people if they had the skill to do the nuance and and come up with something and turn it about in a more natural way. I mean,
yes. And I think also talking it through with the parents will be part of the healing, because then they understand, because now they have no idea why this child is so disturbed.
mm-hmm.
And what's interesting is that the other child is obviously not at all disturbed, and how often the onus falls on one child. And it's to do with susceptibility, I imagine. But he seems to carry all the onus in the family. But then it makes sense, because it was his mother before his pregnancy who underwent that horrific trauma, which was suppressed.
Mm-hmm. He had a certain prenatal trauma.
Definitely. And I think a lot of traumas are prenatal or date back to the parents' traumas.
That's interesting. That really is, because then the parents carry it, and it just osmotically, if you will, gets over, and through their own way that they're handling their own personal realities.
Absolutely. And also in the way they raise their children.
Mm-hmm. Well, tell us a little more in just a second. I'm going to take a break here for the advertisers and the sponsors. I don't know what to call them, advertisers or what to call them. We call them sponsor partners, to tell you the truth, but it feels weird to be talking about them as sponsors. What's going on? We really appreciate it. Anyway, back to it. So the issue would be what we want to ask you about when you get back is some of the experiences that you had referential to other countries that you were in. You have given us a couple of them. And in a moment, when we come back, if you could hit some of the other countries that you experienced in terms of their cultural perspective and how that helped with the, if you will, resistance of that individual coming to themselves. So let's take a break for a moment.
Thank you.
Well, folks, you know as well as I do that psychiatric treatment failure, especially after multiple medication trials and those very, very brief hospitalizations, may prove insufficient to deal at home with the complexity of troubled children and those adolescents from 6 to 17 years old. Improved care, those next mandatory steps, should include a more comprehensive approach to address those multiple levels of challenges, from family to peers to school, diagnostically from defiance to depression, on every level for families, including military families internationally. The Barry Robinson Center's 32-acre open college-like campus in Norfolk, Virginia, provides safety and security and clean, comfortable living. How do we know? We refer folks over there all the time, strongly endorse what they're doing. So for further information, an informed interview, connect at this page, barryrobinson.org/core. Well, you folks already know that here at Core Brain Journal, we're on a mission to introduce you to resources that make significant contributions to the investigation of those predictable mind science applications. Our colleagues at DHA Lab Group provide a real difference with treatment options for people at every level, from first awareness of mind problems to those frustrating times when even well-informed treatment becomes surprisingly unpredictable. For my entire professional life, from psychoanalysis to brain scans, I've searched for, yes, improved predictability. The good news for all of us, from professionals to patients, remarkably effective research offers useful, cost-effective, organic options far beyond guesswork with psychiatric medications alone. DHA lab tests measure unbalanced biomedical details through easily available testing, now available globally for a variety of molecular answers from, for example, methylation, copper, and cryptopyrrole challenges. Check in for more details at dhalab.com core. That's dhalab.com/core. Okay, so we're back now. We're talking about different cultural perspectives. That seemed to be something, Elizabeth, that was intriguing you, because they were quite different. And honestly, coming into this conversation, I had no idea that we were going to be getting into this part of the conversation, because I haven't had that experience with multiple cultures. We have a little bit of it happening in our offices where individuals from different countries, but we didn't have quite the experience that you've had where you were actually immersed in the culture. What do you think it was in the interview in Egypt that led the people to think, hey, we need you over here in Qatar? What was the curiosity that came up there that they wanted to solve in Qatar?
Well, I had a patient in London who was the equivalent, I imagine, of Oprah Winfrey in Egypt at the time. And because of the success of her treatment, she wanted to promote my work in the Arab world.
Oh, I see. Mm-hmm.
And so it was her suggestion. And of course, I didn't know when that when I went there that it would lead me to go to Qatar
Mm-hmm.
and work with that culture also. So I was working with quite privileged people, both in Egypt and in Qatar.
So the issue then was that was the continuation, if you will, of the cultural perspective, is that the successful people and the privileged people had a certain way of dealing with the realities of their lives. Yeah,
I would say so.
So what would be a problem that you had that you kind of rubbed up against? You were working with a person and you didn't quite get it, and then you had, oh my gosh, here's a transformational moment for me. I really need to rethink what I'm doing here. I know this is a difficult question. I'm kind of putting you on the spot a little bit, but I think it's so interesting to think about those things, because here you are, a trained person. You have considerable experience in a rather, for us, unusual way of approaching difficult challenges. And yet you might have a problem from time to time that would be instructive for you even further down the path. So do you have anything that comes to mind like that?
Well, I think when I started out, I didn't have so much intuition, and I think I've developed intuition. And now I think that without intuition, I wouldn't be on this path. I'm thinking of the Indian boy particularly. It was only my intuition and joining up the dots that led me to question in the way I did, which revealed the true core of the case.
Mm-hmm. So the further down you go, the more you actually trust yourself.
Well, I think so, and I think it's transformed my whole approach, and getting out the message is going to be difficult but challenging for me, because I'm asking people to think again and to go much deeper in their prescribing.
Well, you're really taking it much further than prescribing. I mean, in a way, there is the prescription aspect to it, and it sounds very interesting, but you're taking it on a much deeper, more complete psychological level, and you're looking at resistance within that entire group of people that surround the individual in question.
I believe so, because I think the dynamic is a continuum. And if we don't look at the continuum, then we're dealing almost with palliation.
Isn't that true? I mean, that is what goes on all the time. Certainly, I mean, that's been my experience, and I'm coming from a completely different perspective than you are. I mean, that is where we get back into the cookie cutter situation, because cookie cutter is palliation. It's not, we're not going to deal with it. We're just going to quiet it up.
But I think what's so lovely about a case like the one I'm just talking about is that you heal the whole family in the process, because they suddenly realize that maybe a different approach will help, not only for the boy, but also in the way they have dealt with challenges in their life, which have impacted him.
So, Elizabeth, would you say there's a theme that's going on in terms of people that you see in a more, I mean, London is such a sophisticated town, and you have such a diversity of people in London. Would you say there's a theme that when you come back to London, you say, okay, here's the way I experience this culture that's instructive in some way that you could tell us about?
Well, I live in a part of London which is quite well heeled, so quite a lot of people are very neurotic.
Mm-hmm.
And you feel like telling them, well, can't you get a life?
Yeah, right.
But it's interesting, because although I work from an area which is quite well heeled, I do actually receive patients from across the board. So I was thinking last week I had 3 different Indian patients. I had a Muslim, a Sikh, and a Hindu. And that was interesting, because the collective culture was completely different.
Mm-hmm. Mm-hmm.
It's not just about head gear or clothing. It goes much deeper than that.
Well, it's funny because just on a personal note, I had a very interesting conversation with a businessman who's a patient of mine. And as you're talking about, I'm thinking about him because his cultural background, he ultimately showed me a picture of his great-grandfather. I was talking about a person that I'd interviewed. This patient of mine really needs meditation, no question about it, because he's relatively fixed on a compulsive work ethic. And he's very smart, and he's flying back and forth to Europe, and he's a very busy guy, a very interesting guy. But he's locked down on making something happen internationally, and he doesn't really, in a way, have a life. He frequently gets upset with his wife, and we've worked with him, and we used different medications that have been helpful. He doesn't sleep. Getting around to it, he pulled out the picture of his grandfather, and it was so interesting. He was from, and you know about this more closely because you're closer to the Middle East, but there's a particular religion. And it's not Dharma. Dharma is more on the Zen Buddhism, but it's something like Dharma, where they have the white hats and the white beards. Does that ring a bell for you?
Not really.
I really should have been more precise about the name of the religion, but the bottom line is, as we talked about it, it was clear that he was raised very strictly within the confines of that perception of reality. And
then you have to ask yourself, sorry to interrupt, but you have to ask yourself as a homeopath or any kind of therapist, how much do we set out to change that within the patient? Is religion pathology?
Yeah.
And if they don't see it as pathology, is it up to us to set out to moderate that?
Mm-hmm. Well, in his case, he does see it as a problem, but he's so respectful of his heritage because his great-grandfather was a leader in that particular religion. He looks like an outstandingly interesting guy. His dress, his eyes, and so on. And the father was in the same mold, and they were bringing him along as another person in the mold. But the grandfather was a serious leader in the situation. And he loves that entire background, but he also recognizes that it's limiting for him. And I think when he can then get closer to, I'm having a problem with this, how do I actually evolve in my own personality so that I'm not driven without knowing? Again, you were talking about unconscious. This is what's going on with him. He has an unconscious drive to be in another world, to create another world, and yet he's got a very satisfying world, great family, good wife. He doesn't need another world per se, and that is where we then have the difficulty with him.
Well, it's interesting because in homeopathy we have a book called The Repertory, where we look up the symptoms, and some of the emotional symptoms that are covered in that particular person. One is antagonism of self, or antagonism with self, and the other one is conflict of will. So in that kind of case, you could use one of those rubrics to determine the remedy, because if it's creating conflict within him, then it means that he needs help, and it needs to be addressed, I would believe.
Yeah, that's what he's here for. Yeah, that's true. That's an interesting point, conflict of will, because that's, precisely what's going on with him.
Yes.
And we're working on it somewhat peripherally, not as directly as you would, but very, very, very interesting. So where are you planning to, you have this book, and where would you say you'd like to go with this conversation on the larger scale? I appreciate you coming on Core Brain Journal. Where are you, what's your next step? Where are you going with this?
Well, it's interesting because I spent 6 years writing the book, and I haven't really thought about the aftermath. And I have come to realize that there's a whole audience out there in America who seem avid to learn about my book. It seems to be the country that's expressing the most interest, which is very exciting to me because I admire the American brain when it comes to these issues. So I'm very open. I don't think I'll write another book. I'm very interested in writing articles and teaching my concepts, but I still have to find a new path. I think it must take time after such a deliverance to do
Well,
that.
yeah. I mean, the thing is, the book itself is such a large project, but once you have it organized, then a person like you're so warm and pleasant to speak with. I mean, you're a people person, and the book,
Thank you. Thank you.
the,
Well, I'm a good old northerner, aren't I?
well, the book would put you away from people in a certain way, but you had to get it out to get the grid set up, and then you're going back to people. And and what happens over here is you have I didn't know this about your audience, but as soon as you said that about the American public, everybody over here is looking to get away from pharmacology as the simple answer. There's no question about it. They're looking for, and that's why one of the reasons we're so happy to have you on, because I didn't know we were going to go this far into it or where we were going to go with the conversation. But I
didn't know either, because I was imagining different answers to your questions. But for me, it's very exciting.
Well, it is for me. I think a lot of people would say, are there other solutions other than just, getting a label and throwing meds at people? That is the standard of care in the United States.
Yeah, I agree with you. And I don't like labels, and I prefer to treat people who come without a label. And if they do have a label, I try to put that out of the window and just concentrate on them.
Well, we're exactly the same in that way, Elizabeth. I can tell you that. So, do you do virtual consults now that we're on this conversation about your American audience? What do you talk with people through Zoom or through telephone over there in the UK? How does that happen?
Well, I haven't come across Zoom before, but I'm not very technologically minded at all. Mm-hmm. I have done Skype, but I'm very interested to learn about Zoom if it's more helpful.
Mm-hmm. And then do you actually send remedies over, or how do you actually work all that from?
Well, I do, or else if people say they live in New York or a big city and they have a pharmacy and it's easier for them, I just administer or suggest the remedy and then they can purchase it themselves. But I'm very happy to administer the remedies.
Oh, yeah. That's very interesting. Well, I was interested to see also, Elizabeth, in your references that we're going to have in the show notes, that you were very interested in the brain that changes itself.
Oh, yes. Norman Doidge, yes.
Yeah. And then, it's the new science of memory, pieces of light. I mean, you have some very interesting.
Well, I love that book because it's expressing the idea that children need to grow up with a narrative and to understand where they're coming from, however painful it is. And you can actually modulate that message as they grow up, so it doesn't become so painful to them.
Mm-hmm.
So I don't, as I mentioned before, I don't welcome secrets in families. It just doesn't work. It's quite toxic, actually.
So I haven't read that book. So what he apparently does is you work at creating the narrative as it is in a constructive way.
But he's also suggesting that you can alter brain damage, brain structure damage, and the brain structures are very malleable. And I think homeopathy is one of the few tools that can work retrospectively to achieve that.
Well, now that you're talking about that, and just before we close, one quick question, and may take a little more time, but what do you do with an individual who has actually suffered traumatic brain injury in a, of course they would have a traumatic experience, but they also have some brain injury. Have you had experience with that kind of person?
Well, I have, and I have thought about battle scars, and there are remedies that deal with head injury.
Mm-hmm.
But obviously a lot of people, if they have deep pathology as a result of head injury, they may not choose to consult a homeopath. They would trust the allopathic model better.
Yes, yeah. Mm-hmm.
But certainly I would want to help if I could. And I can see certain remedies can actually change the brain function as a result of head injury. So there is potential, but one can never make that final promise with such deep pathology.
Yeah, that is so true. My experience with brain injury is that of all the individuals, they're really the hardest to treat. They're more unpredictable just because the brain, the whole system of the brain isn't working as predictably as you would expect. So you can't, you'll be fooled by the treatment itself, and you'll have surprises when you're trying to treat the person.
You can actually treat blast injury with homeopathy, because there are remedies that match that as well. But I am interested in helping people or supporting people who've been through war and who can't come out of that trauma.
You'd be interested in the Core Brain Journal podcast that we had with Dr. Bart Billings, who is one of the thought leaders in all of the traumatic brain injury. And he's very much quite outspoken against medication for brain injury. And and just look up Billings in the search engine. You can listen to him. It was an interesting interview, and he's out in California. And he has a regular meeting every year for those people who are interested in trauma and post-traumatic. He calls it combat stress.
Oh, thank you for sharing that. I already had a request from some people in Devon in the south of England to go and help some Afghan veterans who are struggling to recover from their traumas.
Yeah, it does take a team, Elizabeth. That's where, the cookie cutter thing is one way. And we talk to people like you because we have a variety of other things that can, as you said just a moment ago, be supportive in terms of bringing other opportunities to avail themselves with an individual. So a person doesn't have to just be disappointed with treatment failure, because, really treatment failure is quite common if you just do it one way, and in the complexity of traumatic and brain injury, no question about it.
I agree with you. Thank you for sharing that.
Well, thank you for joining us, Elizabeth. I really appreciate your coming on board. It's been a fun conversation.
Well, I must ditto that, and it's been so much easier than I expected.
I'm glad it was. You're delightful to talk to, and it's funny that you're over in the UK, because it seems like you're right here in the room with me. It's
good,
amazing. So thank you for taking the time, and we really appreciate it. And we'll do what we can. We'll have all these things in, and your book in the show notes, and do what we can to help you on your way.
Oh, that's wonderful. Thank you, and I will keep in contact with you.
Please do. Thank you very much, ma'am.
Thank you. Bye-bye.
Bye-bye. Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.